Good morning, everyone, and welcome to day 2 of the Agency for Healthcare Administration's week-long webinar series for National Health IT Week. On behalf of the agency, I'd like to thank everyone for joining our webinar today. My name is Chris Wilkie, and I'm the Health IT Outreach Specialist here at AHCA, and I'll be leading today's presentation. Just as a little housekeeping note, this presentation will be recorded, and I will send out the slides for the PowerPoint as well as the recording after today's presentation. Just want to let you know, for all those listening in today, that there will be a couple minutes at the end of the presentation to answer your questions. So there are 2 ways you can ask questions, either entering them directly through the GoToWebinar control panel, or you can also click raise hand and we can phone you in and you can verbally ask your question. On that note, just want to give you a little introduction to National Health IT Week. Here at the agency, we are highlighting a different area of health IT each day. There's a lot of different HIT initiatives taking place throughout Florida as well as the country. And today we're going to talk about how patient records are shared locally and nationally through the eHealth Exchange. For those of you who aren't very familiar with the eHealth Exchange, just want to give you a little bit of background. The eHealth Exchange is a rapidly growing network of exchange partners who securely share clinical information over the internet throughout the U.S. They use a standardized approach to do this. By leveraging a common set of standards, legal agreement, and governance, the eHealth Exchange participants are able to securely share health information with each other without one-off legal agreements. Let's get into today's guest. Our moderator for today's discussion is Pamela King. She's the Health IT Outreach Coordinator here at AHCA. Good morning, Pam, and thanks for joining us today.
Thank you, Chris. I'm glad to be here.
And we also have a special guest joining us today. It's Jay Nakashima. He currently serves as the Vice President of the Sequoia Project and has 25 years of healthcare IT experience. Good morning, Jay, and thanks for being here.
Yeah, well, thank you for having me.
We're really excited to talk about the eHealth Exchange with you today. I was wondering if you could briefly tell us a little bit about the Sequoia Project and your role there as Vice President.
Yeah, you bet. So the eHealth Exchange is a network. So it's a collection of hospitals, urgent care centers, ambulatory practices, urgent care centers, disease management organizations, regional HIEs, and four of our federal partners. So the VA, CMS, the Department of Defense, and the Social Security Administration. And we exchange patient information. So this began as an ONC initiative by CMS and was turned over to the Sequoia Project to expand and mature. So we currently exchange over 200 million clinical documents each year. And we are not tied to any particular technology. So our participants might use a variety of EHRs. Some use Cerner, some use Allscripts, some use Epic, Greenway, GE. It really runs the gamut. And we currently have about 75% of U.S. hospitals in our network, and we operate in all 50 states. And we also have about 70,000 medical groups who are part of our network. And so I am in charge of the eHealth Exchange. I have responsibility for it. And it's my job to make sure that that the network grows and that we continue to exchange patient information safely so that we can improve patient care.
Excellent. Thanks for the introduction, Jay. And without further delay, I'm going to hand the discussion over to Pam, and we'll get in today's question and answer session.
Thank you so much, Chris. And I want to let those of you know that are on the line. We are housed in Tallahassee, Florida, where the hurricane Michael is expected to hit tomorrow. So most of us are working from remote locations. I do have a dog in my location, so if you hear barking, you're not going crazy. There actually is a dog, so hopefully we can get through without too much dog barking as we have our little conversation, Jay. But thank you so much for sharing with us just that high-level overview of the eHealth exchange. And I know people out there are some people out there that have absolutely no clue. They don't even understand what is this eHealth exchange and what does that mean for my organization, or if I'm a primary care provider, you know, what does this mean? So can you kind of tell us a little bit about what it means to be connected to the eHealth exchange?
Yeah, great question. So, you know, I think almost everyone understands the need to exchange patient information for transitions of care, in emergent situations, and so on and so forth. And so the eHealth exchange, again, is the network that connects one provider to another provider, so that they can exchange patient information. And as I mentioned before, it's EHR or technology agnostic, so it doesn't matter if you run Cerner or Greenway or Epic or whatever. Almost all of the EHR vendors support the national standards that we subscribe to. So most providers are able to log into their EHR, and they're able to retrieve a patient, and somehow, depending upon how their EHR vendor has it designed, they're able to search for a patient, one patient at a time, and pull back medical records from nearby or distant hospitals and other providers. And some providers join the eHealth exchange directly, so they would go out to our website, www.ehealthexchange.org, and they look at the information regarding how to join, and they start that process, probably in concert with their EHR vendor. And then other participants beginning this winter, so early in 2018, are going to be able to connect to the eHealth exchange via Care Quality. And I'll get into Care Quality in a few moments, but basically Care Quality is the framework that allows providers who are part of one HIE network to connect with providers using a different HIE network. So you might think of, the olden days back in the early 1990s, and this is hard to remember, and many of us didn't have cell phones so we didn't experience this, but there actually was a time where someone may have had a mobile phone, let's say through Sprint, and they maybe wanted to call someone else who had a mobile phone provided by MCI. And way back when, at some point in the early 90s, people who used Sprint weren't able to call MCI. And luckily, a framework was developed that allowed that cross-network telecommunications to occur. And the same thing is happening now with HIE networks. So again, Care Quality allows you to to reside in one HIE network and to request medical records from a provider in a different HIE network.
And so, Jay, I've got that created a question in my mind. So if I'm a physician and I use a Greenway EHR system, does that mean, or I'm trying to think of, I'm not sure which providers are connected or working in carrier quality, but so if I am on a Cerner or an Allscripts or whichever providers are on there, vendors are on there, does that mean I have the potential to connect with other participants on the eHealth exchange once carrier quality is connected?
Right. So this winter, so let's say early in 2019, the eHealth exchange will onboard or join carry quality. And so you're right, Pam. What that means is that if there's a provider, let's say in Tallahassee, and he or she runs, let's say eClinicalWorks or NextGen as their EHR. Since eClinicalWorks and NextGen are part of carry quality, that provider who runs NextGen or eClinicalWorks will be able to pull back patient information from a provider across town in Tallahassee who's on a different network, who's on the eHealth exchange. And they can use that information for, let's say, a transition of care. And then the converse or the opposite holds true. So even thinking far away, let's say you're in Tallahassee, but one of your patients goes on vacation on a cruise to Alaska and becomes hospitalized. A provider in Tallahassee who's a part of the eHealth exchange network will be able to reach outside or branch outside of the eHealth exchange network and pull back information from a provider in Alaska who's on, let's say, the Commonwealth network. And this would all happen via the carry quality framework.
Okay. And so if I'm a provider, how will I know if my EHR vendor is part of this carry quality framework?
So I'd say there are two ways off the top of my head. You could go out to the carry quality website, and it's www.care and then quality.org. So www.carequality.org, and you could look for your vendor's name. You might also go out to your vendor's website or call your EHR vendor and ask if they're part of the carry quality framework. So I would say either way would work.
Okay. And I know you said it, but when is that connection anticipated?
The first quarter, so sometime the first 3 months of 2019. Now, I might also mention that let's say I'm a provider, and be it a big health system, or maybe even a solo practitioner, and let's say I use Cerner as my EHR. I might call Cerner and say, hey, I want to make sure that Cerner is part of carry quality, and they'll say, yep, we're part of carry quality. We'll say, great. But they're likely to add some clarification, which is great. They might say, hey, Jay, don't forget that that you need to agree, maybe somewhere within the EHR, or doubtfully maybe via a paper agreement, to abide by their network's rules of the road. So the bottom line is that just because even though a provider may be using an EHR that is part of care equality, there might be some onboarding steps that the EHR vendor will have you go through to open up the connection.
Great. Okay, thank you. Yeah, that's very good to know that even just because something is done technically doesn't mean there's not some policy things that providers are going to need to move forward if they want to make those connections and get that information from their patients. And speaking of getting information for patients, can you share with us maybe some of the stories you've heard from providers that have used the eHealth exchange, or how connecting to this national exchange can help with sharing local data, sharing locally in the state of Florida?
Yeah, so my memory's bad, so I don't have any great anecdotes to rattle off. But and boy, but medicine is local. Sure, there are times when patients are going to be traveling and visiting distant health systems and visiting providers they never thought they would have to provide. And of course, there are times when patients venture out of their geography, maybe to visit a center of excellence or something like that. But by and large, 99% of the time, patients are seeking treatment locally. And so, with the health information networks, it's all about the local environment. So obviously, the greatest benefit to the patients and the providers comes when there's a dense geography where many providers are part of the same network, be it the eHealth Exchange, be it Commonwealth, be it the eClinicalWorks network, be it the AthenaNet network or the Epic Care Everywhere network. So the providers really do appreciate it when they're able to exchange with a provider down the street or across town who's also on the eHealth Exchange, because it really does help them with their medication reconciliation. They may interview a patient and ask what medications the patient's taking at home. But many patients aren't great at that, myself included. And if it's an emergent situation, the patient may not be able to rattle off, all of their allergies and their problems and diagnoses. They certainly aren't going to know which lab tests and they've had recently, and they're less likely to be able to report where they have had images taken place. So to the extent that that a provider is able to lower cost, when appropriate, by looking to see, hey, was a diagnostic study ordered and resulted recently, and can that be reused? It's definitely very helpful for the patient, not just in terms of improving cost outcomes, but also in terms of improving the clinical outcomes and the satisfaction outcomes.
Right. Yeah, I totally agree. And I tell you what, I'm going to share, because I do have two anecdotal stories for you that I would like to share. And these are from providers in Florida. We had one provider that a cardiac patient came into their emergency department. They were actually able to go to their exchange, looked at the medical records, the history of the patient, and based on that, we were able to determine how to move forward with treating that patient. And one of the key points of them looking and having that past history, that detailed medical record information was that the typical treatment that they would have provided was contraindicated based on a procedure that he had had previously. So there was a huge benefit to having that information and having that medical record, especially when you're going to the emergency department, where you can't necessarily regurgitate to the doctors what has happened to you, and your family is distraught and can't remember all of the procedures or the names of the procedures that you've had. And then one other one that I'm going to share with our audience, Jay, is we had a pediatric provider in Florida who had a very complex patient. This is a patient that has to be have special transportation to be brought in to see the provider, and the parents had thought that the medical records had been provided to them. Unfortunately, this child had they had moved. They had lived in Florida, moved to California, and then moved back to another city in Florida. And fortunately, that provider was actually able to go and get the documentation, get the medical record information from California, and then also from the other providers in Florida, so that she would not have to send this child back home, because the doctor could not have treated her without having that information. So those were two significant stories where just having that information saved not only to save lives and save energy and the welfare of patients. So two stories you can share if you can remember them. If not, they'll be recorded for you, Jason. You can go into them later.
Well, thank you. Yeah,
sure.
Well, I mean, your question's timely. You know, with Hurricane Michael projected to hit Florida tomorrow, you know, we're going to have some displaced patients, you know, having to leave their home area, providers having to leave their home area. And those patients are going to be displaced. They may be, you know, hours away, and some of them are going to need medical treatment. If you think about the dialysis patients as an example, and hopefully the providers in those more distant area are going to have access to an HIE, and they're going to be able to pull back the patient histories and provide safer and more effective care.
That is a very valid point. Thank you, Jay. You know what? We did promise our audience that we were going to give them a few minutes to ask some questions. So, Chris, do we have any questions?
Yes, we have quite a few. I'm going to try to pick a couple out, and I just want to let the audience members know that for any questions that we can't address because of time constraints today, I will be sure to follow up with you via email. Our first question, and this is a great one, is what are the biggest challenges that the eHealth Exchange currently faces?
The biggest challenges, my gosh, I should be able to answer that in 20 seconds. You know, this is Jay, so I've actually never said this, but I believe that the biggest challenge is clinician time. So I do hear clinicians say, hey, you know, I'm busy with 100 different things, and I don't have time to read through either a summary of patient information or, you know, the details. And so, boy, in a perfect world, I would love to provide clinicians more time to thoughtfully review patient histories before beginning treatment.
Excellent. Yeah, that's a really big challenge there. Let's see. Moving on to another question. We have one that says, is the eHealth Exchange useful for managing chronic conditions?
Yeah, definitely. In fact, I actually, we always use the emergency situations because it resonates with non-clinicians the most. You know, you show up in an emergency room, you're unconscious. what are you allergic to, what medications are you taking. But for the chronic patients, boy, if we go back to the dialysis patients, those with end-stage renal disease as an example, they're being hospitalized on average twice a year, admitted, additional emergency room and urgent care visits. It's ripe for to help with chronic patients.
All right, thanks for that, Jay. Let's see, I think we have time for a couple more questions here. Here someone's asking, are RIOs part of the eHealth Exchange? And for those who don't know what a RIO is, it's a Regional Health Information Organization. Jay or Pam, do you have any insight on that one?
I think it depends on the RIO. So in Florida, we have, and really that's a concept that it's different in different states. Here in the state of Florida, we have a couple of regional health information exchanges, and that's really kind of what a RIO is. But we don't have RIOs in every segment of the state of Florida. I think that may be different in every state. So it would depend on the RIO and whether they have decided to join the eHealth Exchange, and I'll let Jay comment on that as well. I know that we do have a couple of regional health information exchanges that are connected to the eHealth Exchange. Jay, do you have?
Yeah, that's exactly right. So yeah, there are over 60 RIOs and state HIEs that are part of the eHealth Exchange across the country. Some might be in Florida, New York, Minnesota. They're kind of scattered wherever. But if you have a RIO and they're not part of the eHealth Exchange, you might ask them if it would make sense for them to look at that again.
All right. I think we've got time for one more question here. Someone's asking for a little clarification on is the eHealth Exchange, how is it similar or different from Commonwealth?
Yeah, great question. I would say it's more similar than different. So both the eHealth Exchange and Commonwealth are networks. So groups of providers that have gotten together and agreed to share patient information. The primary difference is that Commonwealth represents a group of providers who all use I'll call them similar EHRs. So they might use the Cerner EHR, they might use Greenway, they might use Allscripts. Whereas the eHealth Exchange is even broader. It's every EHR. Commonwealth is where a group of, clumsily put, is where a group of EHR vendors got together and said, hey, let's help our providers exchange information to improve patient care. So Commonwealth is more EHR vendor centric, but both do the same thing, same mission, to improve patient care.
Got it. Thanks for that clarification, Jay. Looks like we're getting towards the end of our presentation, so I'm going to wrap up here with everybody. Pam, thank you for moderating today's discussion. I think we had some great questions. And Jay, thanks for joining us today and sharing your experience and knowledge with the eHealth Exchange.
My pleasure.
Thank you.
All right. Just want to let everyone know, in case you joined late, this presentation was recorded and a link to the presentation will be sent out afterward. Just want to let everyone know that you can join us tomorrow and the rest of the week as we discuss other health IT initiatives. Tomorrow, we are going to discuss the Encounter Notification Service and how providers are using it to reduce readmissions and increase patient satisfaction. On the call, we will be joined by another special guest, Dina Lewis, from primary partners. Once again, everybody, thanks for tuning in today, and we will see you tomorrow.